The purpose of this recording is to educate on how to provide bolus doses of a medication from the smart pump. Patients oftentimes receive a sedative, also known as an induction agent, as well as a paralytic prior to intubation. However, this sedative usually has a short duration of action and does not last long enough following intubation. So, post-intubation sedation is required, and usually a bolus dose along with the continuous infusion is necessary to keep the patient well sedated and comfortable. Following intubation, it is important to avoid any delays and to initiate this continuous sedation. Remember, the patient is likely still paralyzed, and imagine how scary it would be to be paralyzed but still be aware and conscious of your surroundings, but not being able to move. Starting this continuous sedation promptly is key, and the bolus dose carries great significance. So, due to our worldwide crisis, several key medications related to intubation and sedation are in short supply. As a result, we are encouraged to be resourceful by avoiding the use of the 200 milligram per 20 ml propofol vials for bolus dosing, and instead bolusing directly from the 1000 milligram per 100 ml continuous infusion vials. So we're going to discuss how to operate the bolus dose function on the smart pump. So I'm going to turn on my pump. Go to my care area, and I'm going to type in my propofol. And this is for the 1000 milligram per 100 ml concentration, which is the larger vial for continuous infusion. My patient is 100 kilograms, and I'm going to start this continuous infusion off at 5 micrograms per kilogram per minute. So I'm going to check my flow, look at my clamps. I'm going to validate that the drips are flowing, nothing's kinked, and I'm going to hit yes. So now my infusion has started, and I'm going to switch over to give my patient a 40 milligram bolus. So first thing I'm going to do is I'm going to hit bolus function located in the left corner, and I'm going to then need to put in the desired amount, and note that it is asking for milliliters. So a 40 milligram bolus is going to be equal to 4 mLs. I'm going to then hit OK, and it's asking me in minutes. I need to switch this to seconds for the purpose of this particular bolus for our patient. So it's going to ask you, are you sure you want to do it in seconds? I said yes, and I'm going to put this over 30 seconds, hit OK to confirm, and then I'm ready to go. I've reviewed everything here on the screen, so I'm going to hit run. You will now notice that the bolus dose will count up until the full desired dose is administered to the patient. Since this is an additional medication dose being administered to the patient, you must also document this bolus in addition to your already documented continuous infusion. In general, propofol oftentimes reduces blood pressure, so when we're administering the bolus dose of propofol, we will likely see a blood pressure reduction as well. So now that my bolus is complete, the infusion is going to continue. If you have any questions about any of this information, please contact Kim or Ashley, the pharmacist. Thank you.